So what are the tools of modern pain medicine that are available and useful for the treatment of chronic pain? We call them the 5 Ps: pharmaceuticals, physical therapy, psychological care. Please note that as pain is a sensory and emotional experience, and since most patients with chronic pain develop psychological and behavioral issues, these issues must be addressed. We now have a greater appreciation that pain fundamentally alters brain-related circuits involved with emotion and cognitive processing. We also have a greater appreciation that psychologists work to normalize these circuits through cognitive behavioral therapy, also called CBT, mindfulness-based stress reduction, also called MBSR, acceptance and commitment therapy, also called ACT, and other psychological approaches. Procedures. These include injections of local anesthetics, steroids, ablations with drugs or energy sources, acupuncture, implantable devices, and surgery when indicated. And lastly, and importantly, is personal management. This 5th P addresses some of the recommendations of the IOM, or the Institute of Medicine. Functional recovery, emphasis on education and on skills development, personal management, that is the patient assuming responsibility for their overall well-being and being empowered to move from an external locus of control to an internal locus of control. Please note that pharmaceuticals are only one of the 5 Ps of pain management, and while it is easy to write a prescription, a clinician should rarely, if ever, rely on pharmaceuticals alone in the management of chronic pain, and certainly not on opioids alone. As a provider, by coordinating all the 5 Ps and making them available to your patient, you can provide multidisciplinary care. For complicated patients with chronic pain, an interdisciplinary approach where all these services are available at one facility may be a better approach. Unfortunately, in America, there's generally one interdisciplinary facility available for over 600,000 patients, which limits easy access to such care. So what is the evidence for long-term opioid